Hey guys, welcome back to Donation Discussions. My name is Rebekah Stolle, and I'm here on behalf of We Are Sharing Hope SC. On today's episode, we're sitting down with Dr. Wilson. He is an acclaimed surgeon with over 40 years of experience in the medical field. It's a great episode, and I can't wait for you to get to hear it, so let's get into it. Well, thank you, Dr. Wilson, for being here today.
Thank you for inviting me.
Yeah, of course. We're so excited to have you here. Let's get started with you. You are an incredibly acclaimed doctor in the South Carolina area, and I have heard brief bits of your biography. Why don't you share with us how your medical journey started and how, when in your life you knew that this was the career you wanted to go on?
It was interesting that in Hartsville, a small rural town in South Carolina, we had three black healthcare professionals. Dr. McMath was our family physician, Dr. Dixon was the pharmacist, and Dr. Allen was the dentist in that area. And I had been exposed to Dr. McMath. I remember being very sick, fever and that sort of thing. My parents took me in to see him. And he always exuded this calm, reassuring presence in his long white coat. And I guess some people are afraid when they see a white coat, but it sort of made me feel better.
Wow, yeah.
And that started the idea that I wanted to be a physician, and getting that little toolkit sort of carried it on too. And that became my life's goal.
Well, congratulations, you achieved it. Yeah. So you attended medical school, and you're one of, is it 4 African-American students in your medical class?
Yes, I was here at the Medical University of South Carolina in Charleston. We were actually the third class that had been integrated or desegregated.
Wow.
And out of 165 students, there were 4 blacks who we remain very close and very good friends right now.
Wow.
But the experience then, this was during that period of time where it was actually desegregation before we got to where it's integration. Because when you integrate, that means that you're a part of the community. We went into a community that was really not prepared to see us there.
Yeah.
So there were some times that were a little harrowing, but because of where we had been before in undergrad, I think that prepared us for that environment. And actually we were able to get through that successfully. That's
incredible. What were some of the things that you learned through that experience, and how did that affect you as a doctor, those experiences you had in medical school?
Well, I think the primary thing it taught me was perseverance. It's not a question. There's a lot of work to be consumed in the process of becoming a physician. And it seems that sometimes it could be overwhelming. But again, if you just persevere, take it one step at a time. I think the African proverb is, how do you eat an elephant? One bite at a time.
Yeah.
You take each small step, and you take that over a period of time, you get to where you can accomplish that goal.
You've certainly persevered. I mean, over 40 years of healthcare work in the state. Looking over your career, are there any moments that you're exceptionally proud of?
I'm fortunate. I've got any number of points that I'm extremely proud of from the standpoint of the people that I have been around. I'm married and have 3 children, and they've been very supportive of, physicians' time can oftentimes take away from family time to a great degree. So I appreciate the fact that they've been able to help me through this. I've had good associates and partners. My partner, Dr. Dargan, was a heart surgeon in New York. He came back to Columbia, where he was from originally, and we formed a practice. And I, to this day, admire the fact that he would accept me as a newly finished resident in surgery to come into practice with him. And I learned a great deal from him. From a professional standpoint, I was the first black resident in the program in Columbia and here in Charleston. And there were some good benefits out of that because I got to know the system very well, so that I became a part of the medical community to the point where I was elected the first black president of the Columbia Medical Society, the first black president of the South Carolina Medical Association. And those things gave me a platform that I could talk about issues that I felt were very close to me, particularly when it comes to the health care with regards to minorities. That's been a real concern of mine because I have family members who've suffered because of inadequate treatment in the system that exists in the state.
The start of your career to now, those issues that you're seeing in minorities, with access to healthcare and, just equity in the healthcare world. Is it the same issue? How has it changed? What are you advocating for now as opposed to at the start of your career?
Well, I think there's more awareness now that there is inequity in the system. Like I said, in Hartsville, we were fortunate enough to have some Black healthcare professionals, but access to all of healthcare was not the same when it came to going into the hospital. My family physician couldn't get privileges to practice in the hospital, so he'd have to turn you over to someone else. Over the course of time, we've seen that that has improved somewhat, but I think what we're recognizing is that there's been so much neglect when it comes to issues of healthcare with regards to minorities that we're just at the tip of the iceberg of trying to get how do we resolve that.
Yeah.
Now we're looking at what we call social determinants of health, and that includes things like race, location, genetics, all those factors that tie into why incidence of diseases tends to be higher and the outcomes worse in Blacks than it does in whites.
How did your relationship with We Are Sharing Hope come about?
Love to talk about that. I started off, when I was in med school, one of my first clinical rotations was on the medicine service in nephrology, kidney disease. And at that time in MUSC, we had our first patient that was on dialysis and was getting trained to do dialysis at home. They used to have these big machines that they would teach them to do it at home. And at the same time, we had our first patient who had undergone a kidney transplant.
Wow.
And so being in that environment, it got to be very interesting to me about the process of treating kidney disease and even going to the extent of being able to have a kidney transplant. So that exposure started sort of forming in my mind, the importance of being able to help people who have those end-stage diseases that can benefit from transplant. Subsequently, I was asked to be on the board after I finished medical school and residency. I was asked to be on the board of what became LifePoint. As a matter of fact, Nancy Kay was the director. She was a nurse who, at the medical university, was part of the process in transplant, and she became the executive director. Apparently, just recently passed, and I was sorry to hear about that. But LifePoint was the organ procurement organization for the state of South Carolina. I came on as a board member and have had an association with the organ transplant community since then, and have grown in that role to the point now I'm chairman of the board. And I still am amazed at how we're able to change lives and being able to have organ and tissue donation change those courses for patients who are suffering from diseases that we can cure by appropriate management with transplant.
So it's February when we're recording this, and we're honoring Black History Month. And as you look at the Black community and at the organ donation world, could you talk about misconceptions you see in those communities, and how would you, if someone came to you and were asking those questions and you were noticing some misconceptions, how would you address those with them?
I'm amazed at the number of misconceptions or myths that exist with regards to organ donation. I guess the biggest one, first of all, is patients are concerned about the fact that care will be denied because they want to get your organs. And that's purely an educational point that has to be made, that donation is not accepted until there's agreement from everybody that the patient is to the point where he can be a donor. Other misconceptions are, one, if someone donates organs, they won't be able to have an open casket.
Yeah.
Because they don't understand that that's not what the process is all about.
Yeah.
The primary way to deal with all of these is to go out and talk to people and to educate them. And it helps to have people that have positions where they can influence others. The bishop of the AME Church was a kidney failure patient on dialysis, and he received an organ donation. And therefore, the AME Church has made it a point to educate their parish about organ donation, about dispelling the myths that exist. So having someone that people respect get out and talk about that, I think, is one of the best ways to overcome the myths that exist about it.
What are efforts currently in your community that you are passionate about when it comes to healthcare equity and just educating communities?
The consequences of hypertension, consequences of diabetes, and both of those are diseases that can result in the need for organ transplant. So since I've retired, I've had several different hats I've been wearing. I've been the chairman of the board of the Diabetes Action Council, which was a statewide coalition of everyone who's involved in treating patients with diabetes and educating them and trying to prevent the diabetes from getting into the end result diseases, which are renal failure, heart failure, loss of vision, et cetera. I've also chaired the South Carolina Behavioral Health Coalition, which was interesting because when I was in medical school, for a while I had an interest in psychiatry, but I found out I like using my hands. But anyhow, there's a coalition, a behavioral health coalition that dealt with behavioral health, mental health problems, as well as substance use disorders. And I found it extremely beneficial in being able to head that organization up, because we're looking at diseases that have not been widely talked about. People with mental health don't talk about mental health diseases. And so it was very easy for us to see that by making the public more aware of this, we can go a lot farther in treating that. And I've chaired the South Carolina Cancer Alliance, which deals with various types of cancers, all types of cancers. And so those are some of the areas that I've been involved with.
What would you say is advice that you would give to someone who is entering the medical field and is African American?
There is a crying need for more black males in medicine. I'm impressed at the number of black females that have gone in medicine. I think that is very beneficial. We had a black female as a member of our surgical group, and it became evident to me that there's a different approach that femininity brings to surgery that is very helpful. But there are very few black males that are in medical school, and we know that people that look like you do better when they have people that look like you taking care of them. The outcomes are better. So overall, I think that would be beneficial to the black community. I was discussing with a group of medical students when my daughter was in medical school about the need for minority physicians, and a young white female asked me, she said, well, how do I learn how to take care of someone of a different race? And I said, the easiest way is to become empathetic with them. Don't shy away from trying to learn about what is important to them, because oftentimes a lot of those things will have a lot to do with whether they respond to you positively or negatively. And so taking a standoffish approach where, I'm just going to tell you what to do may not work as well as if you can identify with some of the issues that they have.
How did you develop empathy in your treatment?
I think it has to do with the fact that I saw so many diseases in my family and my community. And that was one of the driving forces for wanting to go into medicine, is to try to make people better, feel better, and healthier. And if you approach it from that standpoint, therefore, for the grace of God, go me. If you approach it from that standpoint, I think that helps to build the empathy that you need and understanding. One of the things I learned was it's easy for me to sit in the office and tell a patient, you need to take this medicine, you need to do this, you need to stop doing that. And I want to see you back in 2 weeks. I had an incident where my car broke down. I took it to the car shop, and it took them a month to get it fixed. I found out how to use the bus system. But when I was using the bus system, what I noticed was people that don't have access to transportation have to plan everything very carefully. So when I tell a patient to come back in 2 weeks to see me, they got to start thinking about, which bus am I going to take? What time do I have to get there to take it? And Lord forbid, don't let me be late in seeing you. So you have to think about all of those things that affect patients that don't necessarily affect me or you.
Such a good, tangible experience of walking in someone's shoes and seeing all the barriers that you wouldn't see unless you take that time to
Right.
see what
right.
their life is really
And
like.
that's again getting back to organ and tissue donation. Unless you see what the suffering is from the people who can be the recipients of that, or what it goes through for the families to be donors,
Yeah,
it's something that you don't even think about.
yeah.
But it is so critical. That's why we need to get the story out there about why organ tissue donation is important.
Yeah.
It helps so many people.
When you look to the future, when you think about the future of donation, what it could be 50, 75 years from now in South Carolina, what is your dream for representation of organ and tissue donation, and what steps do you think we should take now to get a bit closer to that?
We're seeing, well-trained, better trained transplant surgeons. We're seeing hospitals that are beginning to recognize their importance in the role of identifying patients who could potentially be donors, and not shying away from that because they don't see it. It's not a process of where we're going to hold off service to someone. It's a well-planned and timed out system. And I think we're seeing a tremendous improvement in the ability of those people who go and deal with the families, sit down and talk with them about the issue of organ donation. Because it can be very, very tricky to get in there at the right time and convince them of what's necessary to be done.
Yeah.
So I think the future is outstanding.
Well, thank you, Dr. Wilson, for your time.
Thank you. I appreciate it.
Really appreciate you being here.